When something goes wrong after surgery, we'll try and figure out who's going to take care of your problem is not a good enough answer. Hi, I'm Representative Ralph Heap. Before the legislature, I spent my career as an orthopedic surgeon. So when I write health policy, I'm not guessing about what might happen during a procedure or in a recovery bay. I've lived it. That's why I carried House Bill 2686. Outpatient surgical centers do serious work, but patients and families deserve to know there's a real call coverage plan to care for any emergencies that occur following their surgery. The bill requires physicians who operate at those centers to give the center an annual call coverage plan that includes how emergency hospital calls are handled and to update it when things change. If you don't meet those standards, it's treated as unprofessional conduct, because in medicine, clarity on coverage isn't bureaucracy, it's patient safety. I also sponsored House Bill 2906 to fix a gap on the State Board of Dental Examiners. Arizona's board oversees dentists and hygienists and complex cases that land in the oral surgery world. My bill keeps the board the same size but requires that at least one of the licensed dentist seats be an oral and maxillofacial surgeon. So when the board is looking at difficult surgical questions, there is someone at the table who has actually done that work. Different specialty than mine, same principle I learned in orthopedics. Regulators should hear from people who have stood on the sharp end of the case, not just read about it in a memo. Good policy should make Arizona safer for patients and clearer for the professionals who take care of them. I'm Representative Ralph Heap, and thank you.